All right, hello. Thanks for joining us. My name is Danielle Hyson, and I'm with my coworker Michelle Murray, and we are two autism service dog instructors that work for BC and Alberta Guide Dog Services. So we're going to talk to you today a little bit about what autism service dogs are, how they help kids with autism spectrum disorder. We'll go over the difference between service dogs, therapy dogs, and emotional support dogs, and then we'll also talk to you a little bit about what you can kind of expect from a service dog out and about in the community and what you can do to support people who might be using one. So we'll just give you a little bit of background information about our organization. So BC and Alberta Guide Dogs was founded and incorporated as a charity in 1996, and it was actually British Columbia's first guide dog school for the blind and visually impaired. We started servicing Alberta in 2002, so we were able to kind of expand our reach and help out two provinces. In 2008, we started the Autism Service Dog Program, and with the main goal to provide service dogs to children with autism and their families, and that was later incorporated under BC Guide Dog Services. In 2018, we expanded yet again and amalgamated our organization with Vancouver Island Compassion Dogs, more well known as VICD, and they provide PTSD service dogs to military and first responders living with an operational stress injury. Basically, the mission of our charity is to meet the growing demand for professionally trained guide dogs, autism service dogs for citizens of British Columbia and Alberta, and PTSD service dogs for citizens of British Columbia. At all times, we meet or exceed international standards that are established by the International Guide Dog Federation, as well as Assistance Dogs International. So we just want to give you a little bit of information about one of our kind of accrediting bodies, Assistance Dogs International. So it is a worldwide coalition for nonprofit programs that train and place assistance dogs. Assistance Dogs International was founded in 1986 from a group of 7 small programs, and since then it's really expanded to the leading authority of assistance dogs or the service dog industry. So ADI does not train or provide service dogs in and of itself, but it is an organization that will accredit other organizations to make sure that we're all kind of meeting a gold standard of care to the animals as well as to the clients. So it facilitates communication and learning among member programs as well, and it also helps to educate the public to the benefits of assistance dogs and getting a service dog from an accredited organization, because really having that accreditation means that we're promoting standards of excellence in kind of all areas of assistance dogs acquisition, training, and partnership. So it is a good logo to look for if you're considering getting a service dog. You want to kind of go down the road of trying to get one from an accredited organization. ADI also provides a standardized public access test. So it ensures that we're training the dogs to a standard that they can pass and behave appropriately in public. And it is a test that we administer to our dogs and our clients once a year to make sure that everybody's just kind of maintaining the same appropriate behavior. And it's nice to kind of have that standardization, because it means that you're really having a dog who's excelling in its work. So we'll give a bit of information about what our training program specifically looks like. So we do breed our own dogs for service dogs and the guide dog program. So we breed, raise, and train our own. We basically have a large volunteer pool who are overseen by staff that raise the puppies from by the time they're 8 weeks until about 14 to 18 months of age. And they're really focusing on providing the foundational skills for being a service dog. They provide really important socialization and kind of create the foundational obedience that we're looking for. When the dogs are between 14 and 18 months, then they come into what we call advanced training. So that's when they actually start working one-on-one with a professional dog trainer. And then we'll spend about 4 to 5 months working with them, really polishing off their public access skills, as well as focusing on the specific skills required for their individual program. So when Michelle and I get a dog, we're obviously starting to train specifically for the Autism Service Dog Program, which will differ from the guide dog program or the PTSD program. So we kind of take them and hone in and zone in on specific skills that they need to learn. Once the dogs are trained and we're confident in their ability to do the work, then we will match them and place them with their families. And when we do that, we spend 2 weeks working one-on-one with them and their dog. So the first week, the first week we spend primarily focusing on primary handler.
Okay, thank you
Sorry,
so much.
Kimberly, I think your microphone.
I appreciate it. Thank you.
Sorry, Kimberly, your microphone is on. Okay, there, perfect. Thank you. Okay, so we'll spend 2 weeks working one-on-one with the families and their dog. The first week we spend just focusing on teaching the primary handler how to work with the dog. So oftentimes that's mom, but it could be dad, it could even be a grandparent. And then once they're comfortable handling the dog in different environments, progressively more challenging environments, then we'll start incorporating the child into the training and have them start getting used to working as a team of 3. After their very last day, we'll run the public access test, which we require them to pass, and then they're graduated. We see them within 90 days of that graduation to make sure that everything still looks good, or if they have any problems, we can help troubleshoot. And then we see all of our clients once a year after that. And like I mentioned earlier, every year we're administering this standardized public access test to ensure that the dogs are behaving appropriately in public. A little bit of kind of information about what our training environments for the Autism Service Dog program look like. We're really focusing on areas that families and kids go with our dogs. So we want them to be comfortable going on trail walks in the forest, going to libraries, going to petting zoos, and not being distracted or overwhelmed by the animals that are there. Different playgrounds with lots of different kids bustling around or musical instruments. Being comfortable walking on a beach in the sand and with the ocean smells. So if you can think about any kind of environment that a family might go, we're trying to kind of mimic that and test our dogs and make sure that they can maintain focus among all of those distractions. I think probably most people who are joining this webinar already have an idea of what autism is, but if you don't, we'll just give you a little bit of an overview of what it is, and then we'll talk a bit more about specifically our clients and the common factors that they have. So autism is a condition that causes impairments in social interactions and communication, as well as restricted or repetitive behaviors. It is a spectrum disorder, as most people know, which means it has a wide range in symptoms and severity. And the popular saying of if you know one person with autism, you know one person with autism really holds true for this disorder. And many children with autism can exhibit repetitive, self-stimulating behavior. They may have meltdowns, and those typically are different from a regular childhood tantrum. So all of these things we're also keeping in mind as we're training our dogs to be an autism service dog. And once we kind of get into matching, which we'll talk a little bit more about, we start tailoring maybe a specific child's meltdown to the specific dog that they're going to have. And we'll talk a little bit more about how we do that down the line. So in general, our clients, we service kids that are aged 3 to 10 years old and that have a clinical diagnosis of autism spectrum disorder. Primarily, we're looking for a history of bolting or eloping behavior when they're out in public. Really, our dog's main task is to act as a safety mechanism for a child. So if a child really has no safety awareness when they're out, they may bolt towards traffic or water or some other trigger. That is what we're kind of looking for when we think, can a dog potentially help with this client? When we're walking, our clients are attached by a tether and a belt system to their dog, and I will show you what that kind of looks like in a couple of slides down the way. So they're trained to resist tension on their working jacket when the child bolts, and that's what we call anchoring. So really, like I mentioned earlier, that's the main specific task that they're trained to do. The dog will feel tension on the jacket when the child tries to bolt, and then the dog will just resist that as well as it can, usually in a sit, sometimes in a lay down, and just prevent the child from going anywhere. And then it's up to the parent to use whatever strategies they have in place to encourage the child to come back to the dog. And that is kind of what reduces, we hope, the bolting behavior in the future. So the primary role of our dogs is to ensure the safety of a child and really enable mobility of the children that we work with, which also increases independence. Our overall goal is to really improve the quality of life of children with autism and their families by providing a highly trained service dog. We never want to add more work to a family. So yes, while taking in a dog is taking in another living being, and that increases added responsibilities in your life, our goal is to have the dog be extremely well trained so it's not an unnecessary burden to you, but that it helps enhance your lifestyle as opposed to diminish it. Our dogs are matched to children exhibiting behaviors that lead to safety concerns and social isolation. And our primary role is to provide safe mobility for children, especially when out in public. Some people have the idea that our dogs may prevent them from escaping from the home. That is not something that we guarantee. Sometimes just having the dog will reduce that tendency, but what we only guarantee is that when the child is working in attachment with the dog, tethered to the vest, that the dog will provide safety if the child were to bolt when they're out in the community. We also find that the dogs can be used to encourage social interaction, which can really help to improve their ability to participate in education and leisure activities as well. So when we're talking about matching, this is where it definitely becomes really important. So we can train the dogs as well as we can and have an amazing dog, but if the match isn't right, it's not necessarily going to work out to the family. So when we're thinking about matching a dog, we're not just thinking about the child, although that is very important. We're also thinking about the parent, the other family members in the home. A family is quite different if it only has one child versus if it has 7 and what a dog has to live with in that type of situation. Oftentimes our dogs have multiple handlers, so it's not just the mom or the dad that's working them, but as I mentioned before, sometimes it's a grandparent, sometimes it's respite care, sometimes it's an EA at school. So we often need to have dogs that can adapt to multiple people. This is very different from most other service dogs because most other service dogs are specifically just for the individual. So if you're blind or visually impaired, you're the only one really that's going to be working that dog. Whereas our dogs, while they're paired to a specific child, have to be able to be handled by multiple people across the board. And then we're also considering specific working and living environments of the family. So some of our dogs may do better in a rural area because they're fine, they have no small animal distraction. Other dogs may do better in a more quiet neighborhood or even a city environment. So we're taking everything into consideration. We think about the strengths and weaknesses of the dog, and then we start looking at the overall personality and environments of each of our clients on the wait list, and we start matching. Well, this dog will do really well with this client. It wouldn't necessarily do well with this environment. So this is a photo of what an autism service dog team looks like. So on the left, facing the screen, there is the parent who's in control of the dog. And then you can see the child. And on the dog, there is that tether attached via a belt that goes around the child's waist. And then the tether's attached to the jacket. And there's also a handle on the vest. So that handle really is important because it becomes almost like a psychological anchor. It gives the child a task to focus on when they're out. So oftentimes, if a child were to drop the handle and bolt, an easy strategy to encourage the child to come back to the dog is, no, come on back. You need to walk your dog, come hold your handle, and we'll continue on. So a lot of times we actually find that over time, the kids can just rely on having that handle and holding onto the handle and don't necessarily need the full attachment system because that psychological anchor, that responsibility, the motivation, and the task that they're given is so motivating and reinforcing that they will just stay walking their dog with the handle and not necessarily need the full hookup attachment system. So the next slide, unfortunately, is not going to work. It is a video. It's only a few seconds, but it was going to show you just basically general traffic safety and how the team of 3 would work around traffic to make it so everyone is nice and safe. The main gist of it is that we train the dogs to stop further back from curbs. So we don't go right to the bottom of a curb into the road. If a child were to bolt, we don't want them to be able to get anywhere near a car in traffic. So we're probably about 4 feet back from the curb, and the dog will just kind of target that spot on its own and sit and hold its position. And if the child continues on walking, it will just resist and prevent the child from being able to wander into traffic.
All right. As we mentioned, the main thing that our dogs do is act as a safety aid in the public to prevent bolting. But our dogs also can provide a lot of other benefits to the kids that they work with. So the next few slides, we're going to go over some of those things that we specifically train our dogs to do to interact with the kids. So on the left, you see a picture of what we call pass. So this is mainly a bonding game, but it also helps the child to work on gross motor skills. And what happens is the child rolls the ball towards the dog, and the dog will push the ball back with their nose. So it's a fun game that they're able to play together. On the right, you see a picture of a dog providing deep pressure to a child. So a lot of children with autism find deep pressure really calming, and it can help to ground the child when they're feeling stressed or or anxious. And we can use that as a coping strategy for the child to seek out their dog, to seek out that deep pressure when they're starting to feel stressed or anxious. On the next slide, you'll see two other tasks. So on the left, we have what we call food eye. It's a game to work on eye contact as well as pointing. So those are nonverbal forms of communication that some of our children that we work with struggle with. So with food eye, we're using a treat that goes on the dog's paw. The dog needs to hold and maintain eye contact until the child points and lets the dog eat the treat. So that's kind of a way to work on communication for the kid. And then on the right, you see a picture of what we call shirt. So the child is practicing doing up buttons that on the shirt that the dog is wearing. And this is really important for fine motor skill development, as well as working on activities of daily living with goals of independence for the kids. So if they're able to do up buttons on a shirt, that means they could potentially dress themselves. And those are some goals that a lot of our families have to kind of encourage that independence. So we find for the kids, when they're learning these skills, it's more fun to do them with a dog and to do the shirt buttons up on the dog instead of their own shirt. So it's just a way to enhance the bond between the child and the dog as well. We did have a video of the food eye, it just to kind of show what it looks like, but again, the video won't work today, unfortunately. But hopefully with my description, you have an idea of what that would look like. On the next slide, we go over some other symptoms of autism and then how our dogs can help. So for a lot of our kids, they might have impaired social interaction, and we try to use the dog to encourage social interactions with the child, especially with peers. So it can be a way to have kids approach the child that we work with and ask questions about the dog. If the child's able to answer some questions, that can be really great for social communication and conversation building. But we also have some visual aids that the families can use to have responses on cards or something so that the child can still present an answer and work on conversation and social communication. Some of the children have a lack of social or emotional reciprocity. For some kids, actually thinking about the feelings or thoughts of the dog is easier than a peer. So we can use the dog as a way to kind of bridge that and transfer those skills then to thinking about how another human might feel for some of those kids who lack those skills. Communication deficits, I talked about, communication with pointing and eye contact that the dog can help with, using the dog as a motivator So if they can learn some of the commands that we use, that can be really motivating for them to actually use words or sentences to communicate. Some kids have difficulty with transitions, and we find because the dog is a constant through those transitions, they can be really helpful, whether that's transitioning between preferred activities or locations. So, either getting out of the car and into the store might be a struggle for some kids, but having the task of holding the handle and walking with their dog helps to ease that time that they're walking from the car to the store or from the car home, or at the park and have to leave the park if that's a preferred place. The dog is that task and that kind of tangible thing that they can go to and then work through that transition in a calm way. A lot of our kids have sensory needs, so deep pressure is a really big one for a lot of them, and that is the deep pressure to calm them. Also, the tactile feeling of the dog's fur, which can be very soft. A lot of the kids like that. So we encourage petting and playing with the dog as well to meet those sensory needs that they have. And then gross and fine motor delay. Again, the pass game that we teach the dogs can help. The shirt game where they're doing up buttons. And we just encourage the family to think about any ways that the dog can be incorporated to teach the child skills or make it more motivating for the child to learn new things, and use the dog as a motivator. So we have also the dogs can play tug, and that can be really good for the kid for bonding as well as actually using the strength of their arms to pull on the rope. So that's another fun game that a lot of our families like to play with their dog. So this slide talks about what is a service dog. This is a question that comes up a lot when we're out in the public. And so we just wanted to talk about what the difference is between some of these terms you might hear. So we have service dogs, and that's the type of dog that we train. Service dog is an umbrella term. So under that, you would find an autism service dog or a PTSD service dog, but they're both under the service dog umbrella, as well as guide dogs. So in BC, we have a Service and Guide Dog Act, and that any dog that falls under those categories are going to have public access rights and fit into that law. So when you see working dogs in the public, they would be service dogs or guide dogs. So there is a chart there, and it kind of goes through some of the different requirements and accessibility things that the different dogs have. So we have service dog, as I mentioned. There's also therapy dogs. So therapy dogs are typically owner trained, and then they go into settings that are usually for groups, sometimes one-on-one, but they're really there to kind of to provide emotional and comfort for the group of people that they're going to. So that could be a nursing home, it could be a school, a library, something like that. And they just have general obedience and kind of behavior things that they're trained to be calming for people, but they're not trained to mitigate a specific disability. And then emotional support dog, often again owner trained, and they do help for people who might have depression or anxiety, but they don't have specific tasks that they're trained to do to mitigate a disability. For a service dog, they're specifically trained with tasks that help to mitigate somebody's disability. In our case, like the anchoring behavior that our dogs do to prevent a child from bolting is one of those tasks, and that's what defines them as service dogs. So you can see as well a brief overview of the difference between a service dog, a therapy dog, and an emotional support animal on the right. Some things of note, so service dogs, like I mentioned, have public access under the BC Service and Guide Dog Act. They also can live in the homes of the owners, even if there's a no pet policy. They can be on flights. They have to work in a lot of new environments, difficult environments, as Danielle mentioned, especially for us, environments where families and kids go. They're specially trained to help a handler with to mitigate their disability. And they're not trained to provide comfort for others. So it is an individual service dog for one person. The primary function is not to provide general emotional comfort to the handler. So you can see all of those differences there, which I think is really useful for people to have an awareness of when you're out in the public and seeing different types of dogs. So when you do see a service dog in the public, we want to talk about how you should interact with them. So if you see a service dog, we always consider them to be working, even if it's sitting or lying down beside their handler. They might look at rest to you, but they could still be working. And it's also a chance for them to rest, between walking or working with their clients. So we consider anytime they're out in the public, we consider it work. So they should not be distracted by members of the public at this time. We ask that people don't talk to the dogs, call the dogs in any way while they're working, since this can distract them, as well as not to touch or pet the dog, again, because this can distract the dog from the tasks that it's needing to do. We also don't want the public to be feeding the dog at any time. It distracts them from their work, but it could also develop into permanent problem behaviors like scavenging or begging from the dog. And our dogs are on specific diets that we want them to follow, so they are not able to have food outside of what we kind of allocate for them to eat. Can I pet a service dog? Lots of people ask, so we want this to be at the discretion of the dog handler. So sometimes you'll see people work with service dogs or service dogs in training, and if you ask them to pet the dog, they might say yes, but it should be their choice. If you do ask somebody to pet their service dog or dog in training, it is best to do so when the dog and handler are at rest rather than walking. And just remember that if you ask someone to pet their dog, they might say no, and that's a perfectly acceptable answer. So on the flip side, how should a service dog behave around me? When you're in the public, what you can look for the behavior of a service dog and what you can expect. So for an autism service dog, they should be well behaved. They shouldn't be jumping, barking, or pulling when they're out in the public. When they're stopped, they should be settled and at rest. And then when they're walking, they should be walking nicely beside their handler. When working or at rest, the autism service dog should avoid temptations such as begging or scavenging for food, chewing on objects around them, and just generally being distracted by things in the environment. This could be other dogs, small animals, smells, food, or people. And the autism service dog should respond to the handler's commands and maintain its concentration on the handler. They shouldn't be looking for attention from, here we have staff or students if the dog is in school, but also just members of the public. And that's also why we ask people not to call to the dog or try to pet them while they're working, so that the dog doesn't learn that they can be looking at other people to get attention. We want them focused on their handler and the person that they're working with. So now we're going to transition into autism service dogs at school. So we do allow our dogs to go to school with the child. This would introduce a new handler, as Danielle mentioned, with an EA needing to be trained to handle the dog at school and be responsible for the dog during the school day. But we find that when the dogs are at school, they can really help the development of not only the child that they work with, but all children. It's a great learning tool. And we really believe that a service dog can be beneficial to the entire school community. We encourage an inclusive learning environment that fosters the growth of communication, social interaction, and independence for students with autism. So, as a teacher, the responsibility in the classroom is to advocate for the student and the use of the dog as an assistive aid to create classroom activities that allow the student to participate with the dog and include the dog as much as possible, to develop IEP goals, so individualized education plans for the children with goals specific to the student and the service dog, and to support the EA as they handle the dog in the classroom. So for some of our students with their IEP goals, it could be to hold the dog's handle when they walk from one class to another class. It could also be helping to fill the dog's water bowl throughout the day to make sure that their dog has water. It could be using the dog as a um, coping strategy if they're getting stressful, seeking out the dog for comfort or deep pressure. And these would all be specific goals for individualized for that student, including the dog. For the EA, they're the educational assistant working one-on-one with the child, and they're handling the dog during the day. So they need to have a full understanding of all the working commands, and they need to learn to handle the dog to ADI standards, Assistance Dogs International Standards. They provide fresh water bathroom breaks throughout the day. They encourage the student to develop independence, communication, and socialization through the use of the dog. They integrate the dog into the IEP goals. They can use the dog as a tool to reduce stress and anxiety, which I just talked about. And they can use the dog to model behaviors. So at school and as well as at home, we can use the dog for modeling, which a lot of the kids respond to. Things like being brushed. So when the dog needs their fur brushed, that can be used to model a child needing to brush their hair, a dog going to the bathroom when kids are working on toileting, things like that. So those can be integrated both at home and at school for modeling behaviors. That is the end of our presentation. So we have now some time for questions from the audience, if there are any.